we provide care, physical care, emotional care, spiritual care, cultural care for people who are experiencing illnesses, and at the time during the disease process and while they're experiencing illnesses. But we also work with those same people to promote health and well-being. And we do that at different levels. We work with them at the individual level, at the family level, community level, and even the population level. So we kind of thought to go through and give you a general background of what nursing is. We start with the historical perspective of nursing, move through the education of nurses and how we prepare our nurses to care for patients, talk about some of the practice issues like licensure and certification, talk about the professionalism of nursing, and then wrap up with a snapshot of what the nursing workforce looks like today in the United States. When we talk about the history of nursing, the history of nursing goes back centuries and centuries. Modern nursing really started to come about in the mid-1800s, much because of this woman on the left, Florence Nightingale, the lady with the lamp. And so she was really one of our first pioneers of modern nursing. She was an educated woman. She was educated in languages, philosophy, sciences. She had a very kind of broad liberal art background. And she decided she wanted to go into nursing, much to her parents' dismay. Her parents did not want her to. Nursing was not viewed favorably at the time. And so shortly after she went into nursing, she traveled from England to the battlefront of the Crimean War. And she wanted to provide care for the soldiers that were part of that war. When she got there, she was horrified at some of the hygienic practices, some of the really poor outcomes that these soldiers were experiencing. And so she began to take meticulous notes about what she was seeing in terms of the poor practice, poor hygiene, and then how it was affecting leading to poor outcomes for the patients. And based on those notes, she began to make changes in her practice. And based on those changes, she could then document better outcomes for the soldiers and better outcomes for the patients that she was caring for. So because of that, because of her meticulous notes and her writings, she sparked kind of worldwide healthcare reform at the time in the areas of infectious disease control, military care, healthcare delivery, and hospital management. She's also credited with being our first nurse researcher. So she was called the lady with the lamp because as she was doing her rounds, checking on the patients, the soldiers, she would go up and down the middle of the ward, the corridor, at night with the lamp to check on the patients. And so the soldiers began to refer to her as the lady with the lamp. So at around the same time, this woman in the middle is Clara Barton. And she practiced at around the same time. She was providing care for soldiers during the Civil War in the United States. So around the same time, but different continent. And she wanted to participate somehow in the Civil War, but being a woman, she wasn't allowed to be a soldier. So she went into nursing and went out to the battlefield to provide nursing care for the soldiers. And she provided nursing care, and another thing that she did is she began to methodically gather provisions, clothing, medications, foods, blankets, that she could have on hand for when the soldiers needed them the most, and she could pass them out at that time. And so this kind of led to what she did after the war, which was in the early 1880s. She founded the American Red Cross. So she's another one of our great nursing pioneers. This woman on the right is Lillian Wald. And Lillian Wald is credited as being the first public health nurse in the United States. And in the late 1800s, 1893, she established the Henry Street Settlement in New York City. And she did this because she was appalled at some of the living conditions and lack of health care for some of the immigrants in New York City at the time. So she established this Henry Street Settlement. And some of the services that they provided visiting nurse services, well baby clinics, education, disease prevention, and they also did minor illness treatment. Another aspect that was really kind of fascinating about the Henry Street settlement is that she looked at how neighborhoods could affect health, and so she was strong in implementing playgrounds in the Henry Street settlement, so that the children had a place to go outside to play that was safe, because prior to that they couldn't go outside without going into these dangerous urban streets. So she was our first public health nurse. She really had a profound effect on public health policy. And the Henry Street settlement still functions today to fight urban poverty. So that was, the end of the 1800s, and as we moved into the new century, the next events that really affected nursing were World Wars I and II. And obviously, there was a need for nurses to go overseas and care for the soldiers as they fought in these wars. There was an inadequate supply at the time of nurses, and so the federal government had to stand up and really heavily recruit nurses and also offer to pay for education. So during World War II, there was this cadet nurse program where volunteers could sign up, and they were provided tuition, books, stipends, uniforms, and then after they had completed their education, they were sent overseas to care for the wounded. The other thing, that went on back to World War I is at the same time that World War I was going on overseas, there was the influenza epidemic that occurred here in the United States. So that really impacted in that we needed nurses not only to go overseas, but we needed them here to care for the population that was being was under siege by the influenza epidemic. So as we move through the century, probably the next time frame that heavily impacted on nursing and healthcare was during the 1960s. And in 1965, Medicare and Medicaid were signed into law. And what that did was really increase the access to healthcare for populations that previously couldn't get there. So elderly, disabled, and the impoverished. And so there was kind of this explosion of healthcare and healthcare needs. And that led to a lot of specialization that went on in the hospital. So nurses were now able to go into specialized areas of nursing like intensive care, cardiac nursing, psychiatric nursing. And at the same time that was happening, the primary care physicians that were out in the community were also starting to specialize. So that led to a decreased amount of primary care physicians out in the community to care and provide those services, which in turn led to an increased role for nurses in that area. So this is where we started to see the development of the role of nurse practitioner to fill in those needs for primary care services. The other thing that obviously was going on during the 60s was the Vietnam War. So once again, nurses are called back into wartime to care for soldiers and patients. This was different though, because during the previous wars, nurses were providing care back in like the hospital wards. So the soldiers would be removed from the battlefield and brought back into the hospital wards to be cared for there. This was not what happened in the Vietnam War. In the Vietnam War, the nurses were out in the jungle with the soldiers, shoulder to shoulder with them. And so they needed to provide care right then, immediately when injuries occurred. This changed the role and changed some of the practice of what nurses were doing because they were called on to act emergently and perform procedures that they previously were not doing. So as we continue to move through the decade, the impact during the 1980s into the 1990s of HIV and AIDS was huge on healthcare and nursing. So in the early 1980s, we started to see the emergence of this virus, the human immunodeficiency virus. And it was not well understood. It wasn't understood how it was transmitted, definitely not understood how to treat it. And so there was a lot of fear in healthcare at the time, a lot of fear for practicing nurses, not sure how they kind of played into that and what their risk and exposure was. And as it was originally thought to be an illness of homosexual men. And as the decades progressed, it became very obvious that they were not the only population that was affected by it. And that became really hit home with the nation in the early 1990s when Magic Johnson was diagnosed. And here he was this, kind of strong, healthy, athletic, heterosexual male, and he got it. He had HIV, and so it really kind of ramped up that level of anxiety at the time. Since then, it's become better understood, and we understand how it's transmitted, and we're making progress at treating it. But at the time, it had huge impacts for healthcare, and it had impacts at different levels. It had impacts at a global level, because these global projects and initiatives were started to help combat it, especially in some of the poorer countries and nations, especially Africa. But it also had impact on nursing practice, day-to-day nursing practice. Simple things like we had to wear gloves now. We had to be extra careful about how we disposed of biohazardous waste. We had to think about needles and needle sticks and concerns surrounding that. So there definitely, this decade had huge impact on nursing practice. And as we move along and into our current century, we are once again faced with challenges. So the September 11, 2001 World Trade Center attacks, and then again in 2005, Hurricane Katrina, really again threw nurses into unknown territory. Nurses were charged with caring for patients in conditions that were unfamiliar to them and actually really unimaginable to them at the time. And these events led the way to a new area of nursing, disaster nursing, and emphasizing disaster preparedness. And so drills began to happen in hospitals and nursing schools to kind of work with that and making sure that the preparedness is ramped up. The other thing that was happening is, once again, we are involved in wars in Iraq and Afghanistan. And these, again, are a little bit different in that, yes, nurses are over there and caring for the patients and the soldiers at the time during combat, but they're also caring for them when they come back here to the United States. So and we're providing excellent care for them over there in the combat zones. And so more and more of them are surviving, but they're surviving with kind of these traumatic injuries and post-traumatic stress disorders. So they're coming back. So we're providing the care overseas, but we're also providing care, long-term care that's needed for them when they come back with some really severe health concerns. And then finally, the signing into law of the Affordable Care Act. And so that's really, it has implemented nursing practice, and we don't even know yet how it's going to fully implement nursing practice. It's definitely increased roles and opportunities for nurses out in the community. With an aging population, people are living longer, and they're living longer with chronic illnesses. So we are caring for them out in the community because they're not necessarily, that's not the scenario that necessarily lends itself to the hospital care. And so they need care out in the community for the chronic illnesses. So that's increasing the role for nurses out in the community. Yes, we're still hospital-based, but we're moving more and more out into the community as well. So it's a little bit of the historical perspective, and I think what you can see is, especially over the past century and a half, as times have changed, nurses have stepped up to meet the needs. We've stepped up to meet the needs of the communities that we care for. So the question then becomes, how do we prepare our nurses to do this? How do we prepare our nurses to step up to these health needs and care for patients effectively? So talk about registered nurse practice. There are different educational pathways into registered nurse practice. And this is an area of controversy within nursing itself. And I'll talk a little bit more about that after. But there are different ways that you can get to become a registered nurse in the United States. So the first way, or pathway, is through a diploma program. And these programs are affiliated with hospitals, and the students will attend classes and then also work in the hospitals at the same time. It's very technical, and it prepares nurses for a career in nursing as opposed to a profession in nursing. This used to be the most common way that registered nurses were prepared, but it's really fallen by the wayside over the past few decades, and there's very few programs like this left in the United States. excuse me, and so the younger nurses that we're seeing that are joining the workforce now, for the most part, they're not coming from diploma programs, but some of the older nurses that are still in the workforce some of them have been educated through a diploma program. So the second way to become a registered nurse, or to pathway to practice, is with an associate's degree in nursing. An associate's degree in nursing is offered through a 2-year program, typically through a community college, and it also is very technical. So it prepares nurses for kind of the technical aspects and technical care of nursing. The third way is through a 4-year program, Bachelor of Science in Nursing, so a BS or a BSN. This is a program that we have here at UMass Dartmouth, and this is your 4-year program that's offered through a college or a university. And so the first 2 years, students spend studying areas like anatomy and physiology, chemistry, microbiology, nutrition, growth and development. So it lays the basis for what comes in the last 2 years, which is their actual nursing courses. So during those last 2 years, they get courses in acute and chronic illnesses for adults, maternal child health care, pediatrics, mental health, and community nursing. And interwoven through these courses, they're learning things like nursing theory, research, leadership. They also are learning about health economics, informatics. So it's really a more broadly based education that we think prepares them better for the nursing profession of today. The next way that nurses can prepare for practice is with an RN to BSN degree. We also have this program at UMass Dartmouth. And what this is, people who are already registered nurses go back to school to earn their bachelor's degree. So this is the typical person who does this is somebody who's graduated from an associate degree program and then goes back to earn that bachelor's. And while they're earning that bachelor's, typically working as a registered nurse. There is a push on within nursing to really make the Bachelor of Science the entrance or the degree for entry into practice. And so the associate degree nurses, they're given lots of opportunities and incentives to go back to school to earn their bachelor's degree at many different levels, from employers and scholarships, and so there are incentives for them to do this. And this, not always, but very often, is through an online program. So it kind of lends itself to that working person who can also participate in online classes. The next way to earn RN practice is through an accelerated or fast track program. And so through the accelerated and fast track programs, people who already have a bachelor's degree in something unrelated to nursing then go back to school and get their ability to earn an RN license. And we also have this program here at UMass Dartmouth beginning this summer. And again, this is most often, not always, but most often offered as an online program. That's how nurses can get into registered nurse practice. And once they are registered nurses, they're really encouraged to continue to be lifelong learners. And especially with the way that healthcare is today, constantly changing, so that we really encourage nurses to kind of keep up with their learning, to keep up with healthcare and patient needs. One way that this is encouraged or mandated, I guess, is that most states require that in order to maintain your nursing license, you participate in a certain number of continuing education units. In Massachusetts, nurses are required to complete 15 contact units every 2 years to maintain their nursing licensure. So that's one way to make sure that nurses can continue as lifelong learners. Another way is for them to go back to school and earn graduate degrees. And so currently there's different graduate degrees that you can earn as a nurse. The first is a master's degree. And so master's level programs provide or prepare nurses in different areas to become either nurse administrators, nurse educators, or advanced practice nurses. So to move beyond that RN practice and into advanced practice. Another advanced degree is the Doctor of Philosophy, or PhD. And PhD programs in nursing are research-based. And so the graduates will typically perform research and or teach. And then finally, and this is our newest graduate degree, is the Doctor of Nursing Practice. And DNP programs focus on and prepare nurses for the highest level of clinical practice and also leadership. So that's how nurses go through their education and how they kind of can get to practice. And then some issues that arise when they are at that is surround licensure and certification. So all states have a mandatory licensure in order for nurses to practice. And the primary purpose of licensing is to protect the public health. The state boards of nursing are the ones who issue licenses, and then they're also the ones, if there's a disciplinary action, they're the ones that will discipline as well. So nurses receive their licenses from the state after they've passed a national licensing exam. So the National Council Licensure Examination for Registered Nurses, or the NCLEX-RN, is the exam that graduates take in order to obtain licensure. So it's a national exam, but the licenses are issued by states. But because it's a national exam, states recognize the fact that licensure has been awarded in other states. So say if we have a license in Massachusetts, Rhode Island would recognize that, and if you pay a fee and can prove that you've been licensed, typically will reciprocate. So nurses don't necessarily have to take the NCLEX all over again in order to be licensed in different states. Certification is different than licensure. I always think of it as kind of a step beyond licensure. It's a voluntary step, and it goes beyond licensure to validate a high level of knowledge and expertise in a certain nursing field. It's a sign of excellence in nursing. And certification is typically awarded again after you pass a certification exam in whatever certain field that you want to be certified in. The American Nurses Credentialing Center, or ANCC, is the largest certification body in the United States. And currently there's 40 different certification programs for both bachelor and advanced practice nurses. Beyond that, and those are kind of the technical details of practice, we want to look at the professionalism of nursing. And so Lucy Kelly, who's a nurse educator, scholar, and writer, described certain characteristics that the nursing profession has, which distinguishes it from other professions. So the first is that it's vital to humanity and the welfare of society. Another characteristic is that we have a special body of knowledge. Nurses have our own nursing knowledge, and that body of knowledge continues to grow through our research and through our practice. Another characteristic is that we're motivated to service, and we're motivated by the importance of our work. We're educated in institutes of higher learning. We have a code of ethics that guide our practice. And we have organizations that support high practice standards. So those are some of the characteristics of the nursing profession. We have guiding documents, so documents that guide our profession as well. And there are three that are probably the most famous, I guess, within nursing. And the first, excuse me, is nursing's social policy statement. And what that is, it's a framework for understanding nurses' relationships within society. So nursing's relationship with society. So the nursing social policy statement is first. Secondly, we have the nursing scope and standards of practice. Excuse me. And that outlines the expectations of the professional role of practice and delineates standards of care. And then finally, we have, and I referred to it, the Code of Ethics for Nursing. It's a public document that reminds nurses and the public of the nurses' obligations and responsibilities to their patients. So we have those guiding documents. We also have barriers to our professionalism, unfortunately. And I referred to one of them before, and that is that we have varying levels of educational preparation. So nurses can enter practice with an associate's degree and do not necessarily have to have a bachelor's degree. And like I said, that causes some disagreement within nursing, and there has been a push on to make the bachelor's level the entrance level for practice. Secondly, we have gender issues. We are a female-dominated profession. We're increasing our male numbers, but we are female-dominated. And in some aspects of society, that's not as well accepted as some of the male professions. We have external conflicts. We have conflicts sometimes with the American Medical Association. As nursing role has increased and kind of crept into some of what physicians have done, there's been pushback from physicians, and they have better lobbyers than we do. The American Medical Association has a very strong lobby, and so they lobby hard to regulate nursing practice. And then we have our internal conflicts. So I talked about the conflicts about education. But we also have conflicts, I don't know that they're conflicts, it's both a positive thing and a negative thing. We have lots of different organizations that nurses can belong to, and it's good in that nurses can kind of go into an organization that supports their specific field, but it also draws out and kind of spreads us out. And so there's not necessarily one central organization. If there is one central one that is the official voice of nursing, it is the American Nurses Association. And so the American Nurses Association is responsible for those guiding documents that I spoke of before. So the Code of Ethics, the scope and standards of care and practice, and responsible for articulating nurses' social policy. American Nurses Association also is in charge of the political activism of the American Nurses Association. So the ANA has a political action committee that's through the ANA. They issue position papers and make political candidate contributions. So if there's one organization, that's really the guiding organization. But then, as nurses go out and specialize, they can get into these more specialty-based organizations as well. These are just two that I put here. So the Association of Women's Health, Obstetric and Neonatal Nurses, Society of Pediatric Nurses, but there's really many of them, emergency nurses, cardiac nurses, respiratory nurses, community nurses, public health nurses. So every aspect really tends to have their own professional organization, which, like I said, draws nurses out from a central location, but it's also a good thing because these organizations can keep nurses abreast of the latest developments in their fields through areas like podcasts, conferences, issue position papers, they have journals, and then members-only websites. So that's where we are in terms of our education and our professionalism. But where are we practicing? What's our status of where we're practicing and where are we at today? So according to the National Center for Health Workforce Analysis, were 2.8 million registered nurses, and that includes advanced practice nurses, that practiced as of 2010. That makes us the largest group of healthcare providers in the United States. We break it down a little bit when we look at the specifics. So in terms of education, 55% of the nursing workforce holds a bachelor's degree or higher as of 2010. And that represented a 10% increase from the previous decade. So we are seeing those numbers of bachelor prepared nurses on the rise. In terms of diversity, we're increasing our diversity as well. So again, as of 2010, there was a 25% increase of non-white registered nurses from the previous decade. There was a 12.5% increase of men practicing as nurses. So we are seeing increased diversity. In terms of the age of the nurses that are practicing, the average age of nurses today has risen slightly. And that's in contrast to the fact that the number of nurses younger than 30 has increased. So we're seeing the number of younger nurses increasing, but what we're also seeing is that nurses are staying in the workforce longer, so that the number of older nurses is increasing as well. And so as of 2010, a third of the nurses that were practicing were older than 50. Kind of increasing on both ends, which is bringing up the average age of nurses. So these are our numbers, but we want to think about, where do we practice? Where do you see nurses practicing? So typically what you think of with a nurse is hospital-based nursing. And we are definitely still in the hospitals. Like I said, we're the highest number in the workforce and highest number in hospitals. So we're definitely still hospital-based. But as I said before, we're also moving out into the community to meet the needs of the community. And so we're in offices as well. And I'm sure any of you who have gone to a well check or brought your kids or your parents into an office have dealt with a nurse. So we're in offices. We are in areas like occupational and environmental health. We're military nursing. We went through the history and the huge history of military nursing, and that continues. We're in schools. We're providing care from the elementary level all the way up through the university level. So there's school-based nursing. We provide hospice, so there's end-of-life and palliative care. And that could be either inpatient or out in the community. One of the new emerging roles is for telehealth nursing, which is nursing through telehealth, so kind of like Skyping with patients. And this has also been big. This has been big with the VA and trying to provide mental health care for some of the patients that are out in more remote locations. And so telehealth nursing is growing in that area, but it's growing for just overall care, especially in remote locations. With faith community nursing. Nursing informatics is also an area that's grown exponentially. So we're working to develop things like database to trace population trends. We work within hospitals and communities to develop electronic medical record systems and how to best suit our needs, because we are ones that are documenting probably the most. And then there's nurse entrepreneurs who start their own businesses based on nursing and nursing care. What are the practice opportunities for nurses who've earned their advanced degrees? So for nurses who have a master's or greater, they have kind of increased opportunities. So they can become nurse educators and work to educate our new nurses that are coming through programs. Nurse researchers. And then we have advanced practice areas of nursing. So advanced nurses with advanced degrees can practice as certified nurse practitioners, clinical nurse specialists, certified nurse midwives, certified nurse anesthetists, and clinical nurse leaders. So I just want to leave you with the overall definition of nursing. And this comes from the American Nurses Association. So nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. So, thank you very much.